You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me on today's episode of Simple Health Radio. I'm your host, Dr. Emron. Recently, one of our online followers reached out to me with a question that she had been thinking about for some time. Her name is Terry, and she is the founder of a nonprofit organization called Giving Voice to Mental Illness. She is also the co-host and producer of a podcast called Giving Voice to Depression. Her website is givingvoicetodepression.com. Terry has been very active in advocating for mental health services, and specifically depression. Take a listen to what she sent me and the question that she is hoping I can answer.
Hi, this is Terry. I produce the Giving Voice to Depression podcast, and in the past 2 years I've probably interviewed 200 people about depression and suicidality. And one thing I've learned is that everybody's experience is different, but there are enough commonalities that I think we can learn from each other. So I want to learn from you. In that space between having suicidal thoughts and acting on them and making an attempt, is there a tipping point or a trigger, something that adds a stress, something that adds to the hopelessness, something someone does, something someone doesn't do, that causes someone to move from ideation to action? And in your experience, what are the odds that someone is reachable in that moment? That if we have the opportunity to talk to them or listen to them, that we can affect a change and perhaps help them reconnect with their desire to live? Thank you.
So first of all, I want to thank Terry for her sincerity and her empathy in helping to manage the very complex issues of mental health. I can tell that she has been thinking a lot about the topic of depression and suicide. I can tell that she has had people close to her who have been affected by suicide. As a medical doctor, this is always a very challenging subject. I will do my best to answer her question about what triggers suicidal behavior in people who were previously functional. I will also try to provide some insight into how common suicide actually is and some of the risk factors that create a profile of those people who are likely to commit suicide. Now, I want to take a moment to actually provide the information for the National Suicide Prevention Lifeline. So this is a 24-hour-a-day, 7-day-a-week service. It is a toll-free number, 1-800-273-8255. Again, that's 1-800-273-8255. This is a crisis lifeline. So anyone who has thoughts of suicide, anyone who feels afraid they may hurt themselves or someone else, or any family members or co-workers or friends who are concerned about what to do should call this number. It's available 24 hours a day. Now first, let's go into some of these statistics about suicide, which are very, very sobering. Over 3,000 suicide attempts occur in America every single day. Many of these are not reported because out of these attempts, about 100 people will die on a daily basis. So again, about 3,000 attempts, 100 people will die. But that means about 2,900 will survive their attempt. So mathematically, suicide attempts are about 30 times more common than the actual deaths. Annually, in the United States, about 45,000 people will die each year due to suicide. Now, we have to break down the vocabulary a little bit based on what doctors and psychologists use when they create clinical notes. So the first one is called suicidal ideation. So suicidal ideation is the thought of harming or killing oneself. This may or may not include a plan. A suicide attempt is the actual behavior to kill oneself. Whether it's successful or not, it's still an attempt. And then about half of the people who have suicidal ideation, so the thought of harming themselves, actually will develop a plan for suicide and ultimately attempt it. Now, a suicide threat is something different. A suicide threat is the talking or an action of injuring oneself, but there's not an intention of dying. For example, if there's a breakup with a boyfriend and a girlfriend, the girlfriend might say, "If you leave me, I will kill myself." And then she may do some behavior that appears suicidal when in fact she had no intention of dying. So that's why we have to separate a suicide threat, which is more of an attention-seeking behavior, from suicidal ideation, which is the actual thought about hurting oneself, and then the attempt, which is the physical act of doing something that would result in death. Now, the question Terry asked is, what triggers that decision to commit suicide? And it's a very difficult question to pinpoint. The reason is that the exact cause is not known. We do know that there is a profile that we can paint of a patient or a person who will be at high risk or even extremely high risk of a suicide attempt. But it's equally effective or equally concerning that people at low risk can also commit suicide. Now, the most common ways to commit suicide include firearms, hanging, and drug overdoses. So firearms include pistols, handguns, rifles. So a physical weapon in the home or the workplace is the most common way that people die by suicide. Hanging or asphyxiation or choking is another common way, and this is usually done in the home or in a dorm or some other setting, sometimes in prison or jail. Now, drug overdoses are extremely common, and these can include over-the-counter medications, prescription medications, and any illegal substances. The key to reducing suicide is to limit the access to a weapon or to these other things that can allow that person to die. Unfortunately, the impulse to end a person's life becomes so strong for these people that they find a way, whether it's to shoot themselves, hang themselves, or take medication or something illegal. That is the impulse. Now, we talked about suicidal ideation, which is the thought of suicide. And if you look at the entire United States and you look at the population of people, in their lifetime, 9% of Americans have thought about suicidal ideation. 9% is a very large number. That doesn't mean they all attempt it, and it certainly doesn't mean that they all die from it, but 9% of Americans have thought about suicide at some point in their lifetimes. Now, men are 3 times more likely to die by suicide instead of women, even though women actually attempt suicide more often. The reason is that men are more likely to use a weapon, like a firearm or a handgun or a rifle, whereas women are more likely to commit suicide by drug overdose. So with a drug overdose, it's possible someone can intervene, take them to the hospital, and do something to prevent damage, whereas with a firearm, unfortunately, it's a one-and-done situation if they are successful. Now, among people who commit suicide and die, over 95% had a confirmed psychiatric illness, and these include schizophrenia, major depression, and bipolar disorder. But there's other psychiatric illnesses that can also cause a high risk for suicide, and these include eating disorders like anorexia and bulimia, any type of abuse, whether it's verbal, emotional, sexual, or some other type of PTSD, is also a high risk for suicide. And then even things like head injuries, which occur commonly from concussions in sports, actually has a link with suicide as well. Now, we talked about the profiles. So a profile is a way to describe an individual in terms of the details that we look or that we can pull out from their demographics or their history. So the highest risk profile would be a previous suicide attempt. For example, if a teenager is breaking up with their boyfriend or girlfriend, maybe they're failing in school, maybe they had some home issues going on, if at the age of 16 they attempted suicide, there is a high risk that they're going to re-attempt suicide later in life, either in college or when they're married or in their middle years. And so a previous attempt of suicide is a strong indication that they may commit suicide again in the future. People who've been admitted to a psychiatric facility or a prison or a jail have about a 50% risk of dying by suicide within a year of getting out. So even in cases where we try to get help for these people who are suicidal, we admit them to the hospital, get them medication, get them counseling. When they leave the hospital or other facility, there's about a 50% chance they're going to die by suicide within a year. And then it's interesting that there's a family relationship with suicide. So if somebody in the immediate family had committed suicide, perhaps a first-degree relative, or even a grandfather or grandmother or a cousin who was close to that individual, there is again a 50% chance that somebody in that family will commit suicide at a later time. We don't know if this is genetic or if it's environmental, but that's a very high figure. And then there's some unusual things that show up. For example, people who live alone have a higher risk of suicide. People who live in rural areas or farms have a higher risk of suicide. We're not quite sure why that is. So people who live on farms actually have a higher risk of suicide compared to people who live in the city. We think it's related to some of the networks and some of the social services available, but we're just not sure. Now, one of the triggers that has come across in the literature is something called an anniversary of a significant relationship loss. So, for example, if we talk about a death, so if a husband and wife have been married for 40 years and the wife dies, that's a significant relationship loss. Now you have someone who's been widowed, and this is overwhelming for them. They'll get through the first few weeks after the death fairly well. They might even do well for a whole year. But when the anniversary of that death comes back, there's a spike in the attempts of suicide at that point. But the same is true for a divorce, or someone who's lost their job, or someone who's lost their child, or even lost their pet. Anniversaries are symbolic, but they're very emotional. And so there is a link where an anniversary can come and the risk of suicide will increase substantially. Now, there's also something that I call hopelessness. Hopelessness is not really a medical term, but it's a condition where people feel like they have no other options. They feel that their life is going to continue to get worse no matter what they do. And this could be a combination of medical issues, financial issues, and social issues. For example, in the medical issues, chronic pain is a very significant factor. So if somebody had a car accident at the age of 25 and they've had multiple surgeries, they're on multiple pain medications, they're disabled, they can't use their legs, they can't run or jog anymore, after about 10 years, they're going to feel very hopeless, that their condition is going to continue to deteriorate. So even though the accident was years ago, that hopelessness gets worse over time. And we do know that those people have a high risk of suicide. Now, there's also financial issues. People do lose their job. People do have to move to a new city, or they do go through other factors that can affect their financial well-being. And that hopelessness can translate into suicide. And then there's the social issues. People who are homeless, people who are bullied, people who have other people they look up to who've abused them. These are all hopeless situations for that person at that time because they don't think they're ever going to get out of it. And then they feel like suicide is the only way that they can actually do anything. So in summary, we talked about a lot of different factors, and we had to talk about them because not one of them is the specific factor 100% of the time that will lead to suicide. So we're trying to build a profile. We're trying to screen people when we see them in the clinic. Even if they come in for a sore throat, even if they come in for a car accident or surgery, as physicians and as nurses and other healthcare professionals, we actually have to screen them whenever possible. So again, the risk factors that do increase the success or the likelihood of suicide in the short term include depression, psychosis, anxiety, significant loss, which includes the death of a spouse or loss of a job, a personal crisis, loss of self-esteem, a divorce, a loss of social support, but even other things like an illness such as chronic pain or medications that can cause changes in the mood, any drugs or alcohol, anything that's illicit has a high risk of that. And then the suicidal behavior of other people, including family members, their friends at school, or even celebrities, does have a possible role in increasing the risk of suicide. Now, I tried to link all of this information online. I will have a blog post about that, but I want to repeat that phone number like we talked about earlier. So the National Suicide Prevention Lifeline, 1-800-273-8255. If you or a family member or anyone else in your circle has a possibility of either suicidal ideation, meaning the thought of suicide, or if they've attempted it in the past and you're concerned they may do it again, please call the Lifeline, take them directly to the emergency department.